Interventions with a king. Discussion and commentary based on articles from Jack, Cardiovascular Interventions.
I'm David Holmes from Rochester, Minnesota, and in the studio today I have Dr. Harnek from Sweden, who's going to talk about the concept of evolution. It's an interesting concept. Tell us about the background for evolution as it relates to the technology that you have been so closely involved with.
Yes, I was actually one of the co-inventors of the device, and we started the development of the devices in the year 2000. It ended up with this from a lot of prototypes with this device that it looks like today, which is two stent-like anchors and a foreshortening bridge section.
What's it for?
It's
Tell
actually
for
treatment.
Going to be for.
Yes, it's for treatment of mitral regurgitation, and particularly will be useful for functional mitral regurgitation, which is the disease, as you know, where you have a functional normal apparatus, but where the annular diameters have enlarged. You lose coaptation due to ventricular dilation and geographic dislocation of the papillary muscles. And for that reason, you eventually will create mitral regurgitation.
There is such huge interest in structural heart disease because the information that we have is that very frequently we don't treat structural heart disease very well. Can you give us just a little bit of background of the patient population that we're going to be seeing, the numbers, the demographics of that?
Of course. From the European Heart Survey, we know that a huge amount of patients are not being treated as they should or be recommended to be treated today. It means that the treatment choice would be surgical, but only about 20% of the patients for mitral regurgitation are being treated surgically. The rest of them are not treated or treated medically. And the medical treatment really don't treat the basic pathophysiology of it and has no influence on the poor long-term prognosis of these patients.
So the device that has been brought along, that you were involved with the development as well as the testing, is aimed at that group of patients that are not being treated surgically, number one, that have presumably and most likely functional mitral regurgitation, and it's coronary sinus based. Tell us about the issues with the trial. It started in 2003, so it's been a long time ago. We've learned a lot since then.
We have learned a lot since then, and of course from the animal trials which I have performed, we never saw any issues with the vessel compressions, which would be the major learnings from the Evolution 1 trial, that is a possibility in humans. Had we known that would have been taken into account and not been done like we did it. But otherwise, we have seen in the Evolution 1 trial that putting in a device into the coronary sinus is completely feasible, and it has some potential to treat functional mitral regurgitation. But be aware, it cannot treat prolapses, for instance. Then you would need edge-to-edge technique if you want to do that percutaneously.
So the Evolution 1 trial was sort of the start of a journey. Tell us about the next steps.
The next steps will be, first of all, the Evolution 2 trial will do accommodate all the learnings that we had from the Evolution 1 trials, particularly about patient selection, which is so crucial and very difficult to do proper. And I'm not sure that we really know today how we really should select the optimal patients for these devices. But first of all, for the Monarch device, which is a long device of the three devices on the market today, that has the potential to have the compression of arteries, and that can be avoided by doing pre-screening with CT angiographies, for instance.
So at the very end of the day, this is going to be a large group of patients. We need help treating them, identifying the optimal approach, and this coronary sinus approach looks like it's going to be an important player, an important technique and tool in our armamentarium. Dr. Harnek?
I'm absolutely sure it will be, and I suppose that in the future the combination of the edge-to-edge technique, the mitral clip, and one of the coronary sinus devices will prove to be the best treatment options.
Very nice. Congratulations.
Thank you. Thank you very much, Dr. Holmes.